Picture yourself in the doctor's office after 60, staring at 3 medications on your list: Metformin, Ozempic, and Jardiance. You've been told they help control blood sugar, but you're still wondering, am I on the right combination? Could these interact with my age, my kidneys, my appetite, or my other medications? Fair questions. Here's the surprising part. The biggest issue often isn't the medicines themselves, it's what happens as your body changes after 60. Today we're walking through what doctors watch for, symptoms you shouldn't ignore, and the medication mistakes that quietly matter with age. Stay till the end, because one overlooked issue can change how safely these medications actually work for you. Let's clear something up first. Metformin, Ozempic, and Jardiance aren't 3 versions of the same drug. They work through completely different mechanisms. Metformin primarily reduces glucose production in your liver and improves insulin sensitivity. Ozempic, or semaglutide, is a GLP-1 receptor agonist. It boosts glucose-dependent insulin secretion, reduces glucagon, slows gastric emptying, and often reduces appetite. Jardiance, empagliflozin, is an SGLT2 inhibitor, causing your kidneys to excrete more glucose directly through urine. Taking more than one diabetes medication can be entirely appropriate depending on your condition. But after 60, these decisions may need extra attention paid to kidney function, hydration, appetite and nutrition, weight changes, other prescriptions, heart health, fall risk, and your overall treatment goals as a whole. And one of these medicines works directly through your kidneys, which is exactly why your kidney numbers matter more than many people realize. Let me share a composite patient, Mr. James, 68, type 2 diabetes. His medications got added over time as glucose control shifted. He watched his numbers improve and assumed lower always meant better. Then came less appetite, weight loss, frequent urination, and dizziness standing, which he blamed on aging. But these symptoms can have multiple causes, not just medication or age. His doctor reviewed medications, blood pressure, kidney function, hydration, weight, glucose, other prescriptions. The lesson: the goal isn't the lowest blood sugar possible, it's appropriate control with fewer problems. This is where metformin deserves a closer look. Metformin has been a trusted first-line treatment for years, and there's nothing inherently dangerous about it, but a few things deserve attention with age. Doctors commonly monitor kidney function using eGFR, an estimate of how well your kidneys filter blood. Kidney function can decline with age, and dosing depends on how well your kidneys work. Mild to moderate impairment doesn't automatically mean stopping metformin, but more significant impairment can make it inappropriate. Common side effects include nausea, diarrhea, discomfort, and reduced appetite. These matter more in older adults, since they can lead to reduced food intake, dehydration, weight loss, and weakness. There's also a long-term consideration: vitamin B12 deficiency, linked to metformin use. Watch for fatigue, numbness, tingling, or anemia symptoms, and bring them up with your doctor. Never stop metformin on your own, but metformin isn't the medication most associated with dramatic appetite and weight changes. That brings us to Ozempic. Before we get to Ozempic, if this is genuinely helping you make sense of your medications, hit subscribe right now and drop a comment with your age and country. I read every single one, and honestly, your questions shape what I cover next. Let's keep going. Now let's talk about Ozempic, and let's keep this simple. It mimics a hormone called GLP-1, involved in regulating blood sugar and appetite, exactly why many people eat noticeably less. For appropriate patients, that brings real benefits: improved glucose control, weight reduction, and cardiovascular benefits in certain populations. But here's the overlooked part: eating dramatically less isn't automatically harmless for an older adult. Maintaining adequate protein, fluids, calories, and muscle mass matters enormously as you age. Common side effects include nausea, vomiting, diarrhea, constipation, and abdominal discomfort, and persistent vomiting or diarrhea can contribute to dehydration. Watch for severe abdominal pain, repeated vomiting, inability to keep fluids down, significant weakness, or gallbladder symptoms. These need evaluation. Not every stomach symptom signals danger, but unexplained weight loss should be discussed with your clinician. So what happens when Ozempic reduces food intake while Jardiance increases fluid loss through urine? Jardiance works differently, It's an SGLT2 inhibitor, and the mechanism is fairly visual. Blood reaches your kidneys, glucose gets filtered, and normally most gets reabsorbed. Jardiance blocks that reabsorption, so more glucose exits through urine, lowering blood sugar. Beyond diabetes management, it offers real heart failure benefits and kidney protective benefits in appropriate patients. It's not simply a blood sugar pill. It's often prescribed for cardiovascular or kidney reasons too. Common effects include more frequent urination, genital yeast infections, urinary symptoms, and increased fluid loss in some situations. This creates real dehydration risk, especially in hot weather, poor fluid intake, vomiting, diarrhea, or certain diuretics. For seniors, dehydration can directly contribute to dizziness and falls. Doctors pay close attention to blood pressure, kidney function, fluid status, and other medications together. And there's one rare but serious metabolic problem people on SGLT2 inhibitors should recognize, even when blood sugar isn't extremely high. Here's a rare but important warning: euglycemic diabetic ketoacidosis, which can uncommonly occur with SGLT2 inhibitors like Jardiance, even when glucose isn't dramatically elevated. Watch for nausea, vomiting, abdominal pain, unusual fatigue, difficulty breathing, or feeling seriously unwell. Risk rises with fasting, illness, dehydration, reduced food intake, surgery, or reduced insulin. This is why seniors need to recognize symptoms, not rely solely on a glucose meter. If acutely ill with these symptoms, seek prompt medical attention. Never stop therapy without guidance except sick day instructions from your clinician. Let's be clear, there's no simple rule saying Metformin plus Ozempic plus Jardiance equals dangerous. These medications act through completely different pathways and can genuinely be intentionally combined for good reason. Metformin targets liver glucose production and insulin sensitivity. Ozempic works through the GLP-1 pathway for glucose control and appetite. Jardiance drives urinary glucose excretion with added heart and kidney benefits. But combination therapy means your doctor needs to consider the whole patient, not just your A1C number. Key monitoring areas include glucose patterns, kidney function, blood pressure, weight changes, hydration, nutrition, other medications, hypoglycemia risk, and cardiovascular or kidney conditions. These three medications by themselves generally don't cause hypoglycemia as commonly as insulin or sulfonylureas, though risk can shift depending on your overall regimen. Take a moment to review your complete medication list, not just these three. Here's a number worth knowing: eGFR, your estimated kidney function. It matters especially with metformin and Jardiance, since both are influenced by how well your kidneys work. But eGFR isn't the only factor doctors weigh. Recommendations depend on your specific clinical situation. Kidney function can also fluctuate during dehydration, acute illness, or certain treatments, so one reading isn't the full story. Know your recent results, and ask your doctor what they actually mean for you. You don't need to become your own doctor, you simply need to know which questions to ask. Let's make this memorable. Here's your don't wait list: severe or persistent abdominal pain, repeated vomiting, difficulty breathing, confusion or severe weakness, fainting, signs of severe dehydration, a severe allergic reaction, symptoms suggesting very high or very low blood sugar, serious infection symptoms, or any new, rapidly worsening symptom while on medication. These don't automatically mean a medication caused the problem. The point is recognizing when you need professional assessment, not diagnosing yourself. And remember, no video, including this one, can replace individualized medical care. Let's return to where we started. If you're over 60 and taking metformin, Ozempic, and Jardiance, that doesn't automatically mean you should worry. Understand why each medication was prescribed, know your kidney function, monitor weight and hydration, and review your entire medication list. Never change anything because of a YouTube video. The goal isn't fewer medicines just because you're older. It's making sure everyone still has a clear purpose. Comment which of these you're taking and where you're watching from. Subscribe, and always talk to your doctor before changing anything.